Takes blondes overboard, no life jackets, no brakes. I've been to Blondes Overboard. Yeah, dive in. Too late, hit the water. Blondes overboard, overboard. Hey, you made it, welcome aboard. Emily and Brittany setting the score.
We are back for another blonde voyage, and today we are at Purpose Aesthetix in Norwood, New Jersey. I believe they call it Upper Bergen County. I was looking at some things the other day about what Upper Bergen County is considered. It's hilarious.
Yeah. New York, I'm like, I'm New York.
Yeah, but you'll get all of like the Yelp for New York, which is crazy too.
You are right.
Right.
That's why that is what's an easy commute for me here. And it's Emily, by the way, for those of you who are listening.
So we're mic back and forth today to make sure that we don't have any echo. So bear with us. But we are here with Heinny Severini, who owns Purpose Aesthetix. And we want to learn all about you. And maybe you could start with your history, how you got started in your position, in your role. Give us like your title and so we can kind of learn a little more.
Yeah, sure. Well, thank you so much for having me. I am very excited about this. So again, yes, name is Heinny Severini. I am a nurse practitioner. I've been in the field for about 18 years now. I did start as a floor nurse in the med-surg unit, then became an infection prevention manager, went into urology, and then I started aesthetics while I was still covering urology.
Oh my gosh. Like I'm sick of looking at this end. I'd like to look at the other.
I call myself a unicorn.
Yeah, totally. So how do you go back to school for aesthetics nursing? How does that work?
So basically you can start taking certifications. There is a like a national you can obtain, but it's a little difficult. There is certain amount of CUs. Basically, you have to do either derm or plastics. So what it does is just take aesthetic course. Start with a basic course, then take advanced certifications and things like that.
Interesting.
Yeah.
Interesting. So tell a little bit about Purpose Aesthetix. Like, how did you found this brand? How is it your business? What's the motivation and the history?
Yeah. So basically, it all starts with the name, right? Purpose, which I love. And that came to me while I was at church, listening to the pastor preaching. And I'm like, wait a minute, everybody has a purpose. What is my purpose in this field? Basically, just empowering women, supporting is more than just injections, looking pretty, right? It is medicine overall. So that's one of the things that I always try to focus, that people understand that it is medicine before it's just aesthetics. And I felt I needed a home, a place where I could be myself and teach everyone who was working with me to do the right thing, to stay grounded, to understand, to do the best for the patients. Especially when you're in jobs that are cash money, right? It could get a little bit finicky at some places. So I wanted to make sure that that foundation was established here. We're ethical, we're doing the right thing. This is medicine. So then that's it. Just started working on everything, which took a little time, and now I'm here.
Yeah, no, it's awesome. And I think it's important, having seen you, a patient or a client, that you look at the overall picture of someone's aesthetics, right? So not use the word again, but like you're not going and saying, I'm just rid of your forehead. I'm just going to do this. I'm just going to do that. I remember our first conversation was very much like, let's look at your overall face. Let's look in the mirror. Like, what is it bothers you and what is it that can be helped, and how gradually do you do these things, right? It wasn't like all in, get the injections, get out. It was very purposeful.
Right. So that's the message that I'm trying to get out there. Yes, you have places where you could just go in and they'll do whatever you want, but you really need to educate the patient on what's best for them. You need to understand anatomy, skin, right? Not only gonna be like, okay, get 20 Botox and you're done. And my focus is just treating the face and neck as an entire entity as a whole. And that's why I think aesthetics has gotten a bad rep. You know, you see these big cheeks or something is off, right? You can't have a 20-year-old lip with a 60-year-old face. That just doesn't look right. So, yeah.
Yeah. What other offerings do you provide here? Because I know it's not just injections, right? What are some other items that you do?
Yeah, so we do it all, and we're growing as we're speaking. So we do lasers. I do have a laser to resurface the skin, not laser hair removal yet, but a laser to help the skin pigment. We do wellness services, IV hydration, IV vitamins, medical weight loss. We're starting in September. We're excited about that.
Yeah.
And we'll continue to grow as we expanding. Right?
Yeah, definitely.
Yeah.
If you're on YouTube, you can see how aesthetically pleasing it is in here. But if you're not, it is very much a vibe to come in here. It does not feel clinical. It feels very beautiful.
Beautiful and at home, comfortable. Oh god. Sorry, I wasn't listening. I think I was listening. I think I was listening, but I just forgot. So I know we touched on a little bit of what you do here. I wanted to know, I see some skincare, I believe. What do you recommend, or when people come in, do you mainly say, this is what you should use, or do you adjust it by each person's skin concern?
Yeah. So basically, when I have a client, I do a full consultation, and that consultation is include everything. We talk about skin, we talk about injectables, we talk about vitamins, supplements, sun protection, right? Yes, so the skincare products that I have here are medical grade skincare, and that's a big buzzword out there because there are products that are just products that you get at Sephora, at the pharmacy, and then you have medical grade skincare, which is backed by science and studies. And in medicine, you have to have some studies, right? How are you going to know that something works? And the products that I have here, which are products that I love myself. So some of the products need to target certain conditions, right? Acne is a diagnosis or a condition. Melasma or pigmentation is a condition. Fine lines. So you want to make sure that you're including a product that targets whatever concern or issue or diagnosis you have. And then we also need products that heal and restore the skin barrier because we have so many chemicals, even light, breaks down our barrier, harsh things that are in the environment. So I do have those products that I'm 100% in. I use myself. So I do let's just start with something basic. And sometimes people think, oh, they're costly. But if you're going to Sephora or any store like that, you're spending $70, $80 on skincare, right? So if you have a product that's going to last you 3 months, why not? Start slow, but make sure that it works,
Right. I'm obsessed with skincare, and you are too. I think one of the things that's so difficult to keep up with is there's so many trends.
Yes.
There's so many of products that are like, you need this. If you're not using this, then what are you doing? And also right now, I have a concern forming. So I have adult acne and I'm hitting 30. So I'm getting my wrinkles, but then it's acne products are for younger people, and then anti-aging products are super more on the side. So I've been having difficulty finding a product that won't be too heavy for my skin because I'm battling some oil problems, but then also moisturizing these fine lines away.
Yeah, so perfect. Come for a consultation. But anyway, this is how I got into this. I developed adult acne. I used to have cystic, painful, acne that was on my lower face. I needed to go and have injections It was just really bad. And I was put on medications and this and that until I acknowledged, and actually I did learn from an esthetician in California that did a consultation with me that like 80% of it was my diet. Things that were worsening my hormonal changes, right? So I learned to stay away from certain things. I know that if I have something like that, that's gonna happen. And then maintaining, treating. So what I do is I do use a product to keep, you know, to treat. And then I use products that restore the barrier. So you're probably overdoing it, then underdoing it. So it's a balance, yeah.
Right.
And start one product at the time.
To figure out.
To
what's
figure
actually,
out, yeah.
It is, and I think the same thing with diet too. Like you remove and you see how your skin reacts, or you remove dairy, and then you kind of go from the same thing with skincare.
Yeah.
So I have pretty skin, so it's taken like some time, but we actually reviewed a bunch of the like popular Korean skincare, and I'm finding that cleansing oil versus like a micellar water done like a tremendous difference in like the texture of the skin. Like I feel like when I was washing my skin after, it felt like dry tight,
right?
And I hate that.
Yeah,
feeling.
so it was stripping.
Right.
It was
So one of the skin lines that I have here, Epicutes, has some of the components are Japanese, you know, Asian. So have an oil cleanser, which is great even for acne prone people. And they have something called a lipid serum, which is basically something that restores your barrier. So drop and you feel like this glob of water just soaks everything in. So I love those as part of the skincare routine.
Yeah, it's so funny. Who does construction, you know this. He looks brazen when he comes home sometimes, but he was the first person years ago. He started with Korean skincare.
Yeah.
And I was like, it must be just something like the guys are like, hey guy, you try this when you get home. You know, like the world of difference.
Like, my wife had this in the cabinet.
In the cabinet, I use the whole thing, you know.
Wow.
But it really does. Like it changes you so much. Awesome. One quick for my own knowledge, collagen. Should we be ingesting collagen versus, tell us your collagen journey.
I feel like ingested collagen helps more with like the joints and like that. When we need collagen for skin, we need to either inject it something, right? We have biostimulators, which are injectables that actually help you to make collagen elastin, or procedures like microneedling, right? I love microneedling. That's like one of my top favorites. And that's because you're telling your body, hey, don't stop, keep making collagen. So yes, hair, nail, joints, skin, but then when we need elasticity, right, that pinch and stretch, we need to do something else about it.
Okay. No, that's really good, because I feel like there's again, back to the trends, back to the marketing of it all. It's in water, it's in like, proteins and everything.
The bone broth.
Right.
Yes.
I was drinking bone broth and I was like drinking sweaty socks. And my knees did feel better.
Right.
However,
Your
my
joints.
skin looked the same.
Yeah, I think it's for the joints. Yes.
Do you feel, because you have a medical background in this is your everyday, do you ever get stuck into the trends or try them out?
No, and it's hard. Now there's a trend for PDGF, which is growth factors that all injectors are using, right? And I'm like, I'm gonna wait. I'm not gonna buy it. Number one, anything that I use or have here, I try myself. I try on the people that are around me so I can see. I just don't like jump into it. You could really be a little bit, I don't know, persuaded, whatever you want to call it. But yes, they do have trends in aesthetics too.
Yeah, totally.
What's the under, is that because you said the
salmon sperm, PDRN now. It's
no. The one that they're taking your platelets and they're spinning them and then
PRF, yeah.
PRF.
Yes.
What do you think about that?
I love that.
Oh, really?
I love it. I actually do have it as a procedure here. We do have the PRF, which is just the liquid part. Draw the blood, spin it, get the growth factors, put it back in the skin, inject it. But we can now also make that liquid into a gel form, which allows to fill a little more, longer lasting, especially for the under eyes, which is a problematic area. I love it. It's your own body, right?
Right. Is that mainly for hollowness, or will that help with darkness as well, or both?
So like tightens, helps to the skin, helps with the pigment, and then the gel helps to fill a little bit. For the under eye, it's tricky. You have to see what the issue is, right? Is it thinning of the skin? Is it pigment, or is it, some people have bags?
Right.
A lot of components are hereditary, especially the pigment and the bags. So you manage it, you treat it. You can't cure it, right? Unless you have these big bags. That's when I say you got to go for surgery, you know, because that's 100% correction. Yeah, just take it out. But you manage it, control it, improve it. And if patients are okay with, listen, I'm okay with looking 30% better, then I'm your girl, you know?
Somewhat of an improvement.
Yeah.
Totally. Yeah. Okay, so I think we'd love to get your opinion on my face. Yeah, let's so I think we can move over to your treatment chair and talk a little bit about facial balancing.
Yeah.
Okay, cool.
Sure, let's do it.
All right, let's do it.
So basically, what is facial balancing? That's treating the face as an entire entity. Like I said, we're not only gonna single treat an area. For say, if she comes to me and says, these lines on the upper face bother me, we can smooth that, treat that. Remember, Botox is a stop in your journey, right? You get it, it goes away, 3 to 4 months, you're back, right? So we have to do something for the journey. Just continue a treatment plan, and that's the focus, not just treat now. So when I look at her face, she's gorgeous. She's got a good bone structure. She's got a good lower face support too. I would say there's some lines at rest, right? When we look at somebody, there is dynamic lines, the lines that we make when we're moving certain muscles. Now these lines are likely there without movement. So that means we need to stop or decrease the movement, which is only done by Botox or neuromodulators. And we also have to do something for the skin because these lines start becoming like little scars. After a certain age, for myself, after the age of 35, I don't know if a lot of people are aware that Botox can also be given in other parts of the body, especially the lower face. That's more advanced. That's not done by everybody. So that's part of facial balancing. Some of the muscles in the lower face start pulling the face down. So I would like to give her a little bit of Botox around the corners of the mouth to turn that frowning, around her jawline, to just make the jawline look tighter. For her, probably twice a year if she's doing other skin treatments. If she's on a good skincare routine and maybe some microneedling, that will help to smooth out the lines, close the pores, fix the pigment. And also what we're gonna try to do with Botox is just open up her eyes a little bit, smooth out the lines on the sides. Maya, just a small dose here because she's got this big, beautiful, high cheekbone. So I don't wanna stop that, I wanna keep that. If you overtreat her with Botox, then we're not gonna have that entire cheekbone go up. So I like that. When I look at a female's, let's just say lower face, I'm looking at the chin and the lip. For a female, the chin and the lip should touch. So I would say, do you like your lip? Do you like to enhance your lip? She can use a little bit of a some lip enhancement, right? Because she has just such a strong lower face. Right?
Wow.
Her eyes are big.
When you say the lip should touch the chin, do you mean this?
No,
What
this
do you
bone,
mean?
the apex of her chin with her lower.
Okay.
You see, so she was a little bit more up here, right? And then I would say, listen, you're how old now?
36.
36 is a beautiful age. So microneedling is great because that's gonna help me with that collagen production. So, and what happens is we start getting a little bit of a volume loss here. So I would say, listen, maybe in a year, next year, we're going to do 1 vial, 1 syringe of a biostimulator to tighten the skin and just to smooth out these shadows. We call it the chin shadows that start occurring. Then the neck, if she was to microneedle, I would definitely microneedle her on her neck for those lines that start getting worse, because we're probably born with them. I was born with mine, but they just get worse as I get older.
What about here? So I noticed as I lost all of my baby weight, here started looking funky. Yeah.
So some of this is a little bit of skin, right, from gravity. So she's losing weight, so everything is coming down. You really have no fat, but this is a little bit of skin. So as we tighten the skin and reposition, then this feels better. One test that I like to do, because everybody's like, I have a double chin. Like people like me that have this is just a hereditary weakness of the muscle, are always gonna have a double chin. So I'll have them put the tongue on the roof of your mouth. Is it there? Oh, she doesn't have it. Look at me. You see that?
Interesting.
You see that? So I'm always gonna have a double chin because it's a weakness of the muscle, and that's only fixed surgically. You don't have it. This is just a little bit of skin laxity that is occurring because you're losing weight. So with that said, the best way to lose weight after 35 is just 1 pound to 2 a week. And then do something to help with your collagen, microneedling probably.
So you had mentioned that you offer weight management.
Yes.
What does that consist of?
So we do have compounded medication for weight loss, tirzepatide and semaglutide. A consultation is needed, of course. We review your blood work, we review your medical history. You have to meet the criteria. You have to be a candidate for it. And then it's basically an injection once a week that you do yourself.
What about, because I know a lot of people have needle phobias or they're nervous because it's one of the needle.
No, for us, because it's a compounded, you have to draw it. But if somebody does, I'll have them come in for the first weeks and I'll do it for them. And then they really are like, oh wow, it's such a small needle. It's not a big deal.
Question. Very good question.
Needles make me a little nervous.
Do they?
Slightly.
Interesting.
I have stuff come in me, so it's not a complete phobia.
Just knowing,
it's more about what happens if something goes wrong.
Got it.
But that's
with anything.
Got it. Well, thank you so much.
Yeah.
This was very educational. I didn't know the thing about the chin. That's so interesting.
You're not fat.
No.
You're just a little old.
I'm a little old. Thank you so much. Keeping me humble.
Mine's genetic too. I've always had that.
It's so interesting.
I'm a young child.
She's a young baby.
One down.
Cut right off.
Is there anything else that maybe about your services or specials or anything you would like?
Your membership? I know you have a membership.
Yes.
Yeah.
So one of the things that we offer is a membership. It's called the Purpose Elite. And I love it because that gives me and the patient loyalty. So it's $99 a month. Basically is bankable. The money's kept here. We don't take it. You bank your money here. And it gives you access to some of the discounts. Discounts on fillers, discounts on packages, discounts on wrinkle relaxers and skincare. And basically, you're going to be getting a free injection, whether it's glutathione or something for immunity or B12. So
Is there a contract with that membership?
yeah, so it's a 6-month requirement. And then also as part, when you become a member, you get your welcome back, which includes some of our skincare too.
Ooh.
And since you have the membership, do you also have, what's that, Ally?
We don't. Ally is points for Botox, but we do have Cherry, which is a payment plan.
Okay, cool.
Cherry gives you instant access. You get to choose what your payment plan is, and for some of the programs do offer 0 APR. So
That's great. Good questions. You're so good at questions.
yes, you are.
She's a journalist.
I like the skin.
Well, thank you so much for coming on a blonde voyage with us.
Yes.
Come and see Heinny at Purpose Aesthetix in Norwood, New Jersey. get a consultation, and we'd love to see you here.
Yes.
And remember to follow us on Blondes Overboard Pod on Instagram. Email us, blondesoverboardpod@gmail.com. And do you want to give your handles as well?
Yes, so our Instagram is Purpose Aesthetics with an X at the end and underscore. And our email is info@purposeaesthetics.com.
Perfect. Thanks so much. See you
Thank
next time.
Bye.
Bye.